world-class city lacking life-saving care. Las Vegas is a top travel destination, culinary mecca, and entertainment capital. But when it comes to health care, you might have to leave the state. Contact 13 Chief Investigator Darcy Spears explains how a matter of life and death boils down to dollars and cents.
If you want plastic surgery, Las Vegas is the place. Fertility treatments, gastric bypass, check. There's even a push to make Sin City a medical tourism destination. But if your heart gives out, you just might be out of luck.
What?
Lori Gerhardt is 57 years old and she's dying.
My heart is too big.
She had a heart attack in November 2013 and was pronounced dead on arrival at the hospital, but managed to pull through. After surgeries,
I had angioplasties with stents.
And a medically induced coma, she's being kept alive by medications.
This is amiodarone. This makes my heart beat.
But it's all just putting off the inevitable.
We are struggling with the care of heart failure patients.
Dr. Chowdhury Hassan is Lori's cardiologist. He says her only hope is a heart transplant. But despite record increases in organ donations in Nevada, Lori can't get transplant surgery here. To save her life, she'll have to leave the state.
All the doctors can do is keep you alive long enough to move you out.
Lori says the doctors here are amazing, but there's only so much they can do.
I had a really bad spell and I was rushed to the hospital, and the next day I was medevaced to San Diego.
After an agonizing wait, good news came in January when Lori landed on the wait list for a new heart at Cedars-Sinai Medical Center in Los Angeles. But her Nevada Medicaid doesn't cover anything out of state.
It's just constantly a fight, financially, emotionally.
Lori knew she would die if she had to count on Medicaid. She finally got primary insurance through Nevada HealthLink that's willing to contract with out-of-state hospitals. It costs her nearly $600 a month out of pocket. Plus,
I have to pay to drive to LA and back every month. I have to get a motel room. We have to pay our food and everything.
Lori is on disability and can't work. Her husband often has to turn down jobs to deal with the travel, which will continue for months after the transplant.
Well, it's a huge problem for the patient and the family.
Dr. Hassan says there's excellent care in place for most cardiac patients in Las Vegas, but an advanced program including transplants will save lives. So how does Las Vegas stack up against other cities of similar size? Contact 13 learned that Austin and San Antonio both have heart transplant programs. So do Kansas City, Indianapolis, and Orlando. Even smaller cities like Tucson, Arizona, and Lincoln, Nebraska offer advanced cardiac procedures to serve surrounding areas.
We are trying to build a program, but we just do not have the infrastructure logistics for the advanced heart failure.
Liver, lung, pancreas, and intestine transplants are also not available in Nevada. Same applies to a certain type of bone marrow transfusion. There's a severe lack of resources for some metabolic treatments and for pediatric rheumatology and orthopedic specialties. Contact 13 learned in some cases, care is only available from doctors who periodically fly in from out of state. Lack of a medical school is the primary roadblock.
If Vegas is good in everything, then why not in medicine?
Dr. Hassan says about 100 patients will directly benefit each year from an advanced heart program here in Las Vegas. Darcy Spears, Channel 13, Action News.